The Secretary of Health and Human Services agrees to testify before Congress. A new report is released regarding the 340B drug pricing program. And a longtime leader in Congress announces their retirement. For the week of April 28th, 2025. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Let's begin. Bobby, if I may, because you said I could, you had once described yourself as pro-vaccine to me. Now, the context of what I'm about to ask is that there's multiple studies establishing the safety of measles and hepatitis B vaccine, and specifically that they are not a cause of autism.
Kicking this week's episode off with news from Capitol Hill, where Secretary of the U.S. Department of Health and Human Services Robert F. Kennedy Jr. will testify before the Senate Health, Education, Labor, and Pensions, or HELP Committee in mid-May. A specific date has yet to be set for the hearing. HELP Committee Chair Bill Cassidy, a Republican physician from Louisiana who you heard at the top, and Ranking Member Bernie Sanders, an independent senator from Vermont who caucuses with Senate Democrats, sent a request for the Secretary to appear before the committee on April 10th to discuss the recent HHS reductions in force and proposed reorganization, but the Secretary did not formally respond to the initial request. An HHS spokesperson has framed next month's hearing as part of the normal proceedings surrounding the President's budget proposal. It will be Kennedy's first time before Congress since overseeing a major restructuring of the department. HHS staff recently told the House Energy and Commerce Committee that the Secretary may not be able to speak about the recent HHS reduction in force until 60 days after personnel dismissals.
Here she comes again when she's dancing beneath the starry sky. She'll make you feel. Here she comes again when she's dancing beneath the starry sky.
More news from the Senate Health Committee today, where Chairman Bill Cassidy has released a report detailing the findings of a years-long investigation into the 340B drug pricing program. A statement from Cassidy reads, quote, "This investigation underscores that there are transparency and oversight concerns that prevent 340B discounts from translating to better access or lower costs for patients. Congress needs to act to bring much-needed reform to the 340B program." Unquote. Potential reforms suggested by the report include 1. Requiring covered entities to provide detailed annual reporting on how 340B revenue is used to ensure direct savings for patients. 2. Addressing potential logistical challenges caused by increased administrative complexity. 3. Investigating the types of financial benefits contract pharmacies and third-party administrators receive for administering the 340B program. 4. Requiring transparency and data reporting for entities supporting participants in the 340B program. And 5. Providing clear guidelines to ensure that manufacturer discounts actually benefit 340B eligible patients, including examining legislative changes to the definition of eligible patient and contract pharmacies' use of the inventory replenishment model.
First of all, let me say that I think that there's a big difference between knowing something and realizing something. We've always known that this was a problem, that too many of our pharmaceuticals are coming from other countries, but we realized it during the pandemic. And we realized
that was the voice of Representative Buddy Carter, a Republican pharmacist from Georgia, who alongside Representatives Claudia Tenney, a Republican from New York, and Gus Bilirakis, a Republican from Florida, launched the American-Made Medicines Caucus last week. The group will focus on promoting policies to onshore and friend-shore pharmaceutical manufacturing, strengthen U.S. economic and national security interests, and reduce America's reliance on adversarial countries for essential medications. In a statement, Representative Carter said, quote, "China determines whether we have the pharmaceutical products we need in the United States to keep our citizens healthy." He went on to say this is a terrifying reality, one we must address. before the next public health crisis. Unquote.
Right.
Can you guarantee that Medicare, Medicaid, Social Security will not be touched?
Yeah, I mean, I have said it so many times, you shouldn't be asking me that question, okay? This will not be read my lips. There won't be read my lips anymore. We're not going to touch it. Now, we are going to look for fraud. I'm sure you're okay with that.
Shifting to
Like
news from the
people that
administration
fraud.
today, where President Donald Trump stated in an interview last week that he would veto legislation that includes cuts to the Social Security, Medicare, or Medicaid programs. Congressional Republicans are currently drafting a budget reconciliation package to advance the president's domestic policy agenda, including tax cuts, energy policy, and border security, while trimming the budget deficit by at least $1.5 trillion. This includes $880 billion in savings over the next decade from the House Energy and Commerce Committee, which is expected to necessitate cuts to the Medicaid program. President Trump indicated that he would be open to policies that reduce Medicaid waste, fraud, and abuse. House GOP leadership is aiming to enact the budget reconciliation bill by the end of May, while Senate Republicans have discussed completing the process by August. House committees are scheduled to begin marking up reconciliation packages as early as this week. The House Energy and Commerce Committee expects to mark up its package next week.
The decision of whether to run for re-election has not been easy. I truly love the job of being United States Senator, but in my heart, I know it's time to pass the torch. So I'm announcing today that I will not be seeking re-election at the end of my term. The people of Illinois have honored me.
That was Senate
with this
Minority Whip Dick
responsibility.
Durbin, a Democrat from Illinois, announcing his decision to not run for re-election next year. Senator Durbin was first elected to the Senate in 1996 after serving for 14 years in the House of Representatives. He's held the number 2 leadership post in the chamber for more than 20 years and currently serves as the ranking member of the Judiciary Committee. Durbin is one of 9 current lawmakers who spent more than half their life in Congress. Final news today, where the U.S. Supreme Court heard oral arguments last week in Kennedy v. Braidwood Management. The case will decide the constitutionality of the Affordable Care Act's preventive services mandate and requirements for no-cost access to services as it relates to the U.S. Preventive Services Task Force, or the USPSTF. The Supreme Court appeal follows a lower court ruling that the USPSTF is unconstitutional because its members wield power that resembles legislative authority without being appointed by the President and confirmed by the Senate. The Trump White House has aligned itself with its Biden administration predecessors in defending the preventive services requirement and USPSTF. However, the new administration goes further in its arguments regarding the authority of the HHS Secretary. The Biden administration previously argued that USPSTF's authority derives from the HHS Secretary, who retains a supervisory role over the task force. The Trump administration further argues that the HHS Secretary has full authority over USPSTF, including final say over its membership, recommendations, and course of studies. A majority of the Supreme Court appeared skeptical of the plaintiff's challenge to the law last week. The court ordered more briefings after arguments on Friday, asking the parties to discuss the HHS Secretary's authority to appoint the members of the task force. A ruling in the case is expected by the end of June. We end each week's episode with a call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Tuesday, April 29th at 10 a.m., the House Veterans Affairs Subcommittee on Oversight and Investigations holds a hearing titled Answering the Call, Examining VA's Mental Health Policies. Second, on Tuesday, April 29th at 10:15 a.m., the House Education and Workforce Committee hosts a markup related to budget reconciliation. Third, on Tuesday, April 29th at 10:15 a.m., the House Energy and Commerce Committee gavels in a markup of multiple healthcare-related bills. Fourth, on Tuesday, April 29th at 10:30 a.m., the Senate Veterans Affairs Committee convenes the hearing Bridging the Gap, enhancing outreach to support veterans' mental health. 5th, on Tuesday, April 29th at 2:15 p.m., the House Veterans Affairs Subcommittee on Health gavels in a hearing titled Dignity Denied, the Case for Reform at State Veterans Homes. 6th, on Wednesday, April 30th at 10 a.m., the House Veterans Affairs Subcommittee on Oversight and Investigations holds a hearing titled Answering the Call, Examining VA's Mental Health Policies. 7th, on Wednesday, April 30th at 10:15 a.m., the House Education and Workforce Subcommittee on Health, Employment, Labor, and Pensions hosts the hearing Investing for the Future, Honoring ERISA's Promise to Participants. And last, on Wednesday, April 30th at 10:30 a.m., the Senate Appropriations Committee convenes a hearing titled Biomedical Research, Keeping America's Edge in Innovation. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.